Anybody here? Wait and see if anybody comes up. Anybody here? Wait a couple minutes, see if anybody comes in. Mr. Benjamin, how are you? Congratulations, I saw you won something with Evan's post, or his live today. All right, looks like we got a few people coming on. So, Spags, my main man. So what's going on with everybody? Thought I'm just going to jump on live. We'll talk about a few things. See what you all want to talk about. We can discuss any medical stuff, medical equipment, treatment on things, questions you have. Thought I'd talk about in a little bit about some treatment of hypothermia, things like that. Since it is cold and got pretty cold here the last couple of days, so thought we would discuss some of that. So, what's everybody, what are y'all doing today? Do anything good, fun, productive? You work a night shift, Benjamin? Spags, how's the new job going? So I thought we'd kind of talk about, everybody talks about it, and I've talked about it a lot. Your EDC, everyday medical stuff. What are you carrying? How are you carrying it? A lot of people complain about things are too bulky, it's too hard to carry. What are you all carrying every day? What's something that, or challenges you all have found trying to carry EDC? I mean, I carry a tourniquet every day. I carry a basic IFAC. This is my EDC kit. I build these with my company, homesteadmedical.us. It's our website. Probably that's the biggest challenge of carrying medical every day is the bulkiness, things like that. It is a little difficult to carry. But what have you all done? Have you all found a way to take care of it, or what are you all doing? I think the biggest thing is the size. Now this, I've got a full IFAC in this. This is special operations equipment pocket organizer. You can get these from John. I also sell these as complete kits with John's permission, but you'll get the pocket organizer and a full IFAC. I've actually got inside, I've got wound packing gauze, pressure dressing, nasopharyngeal airway. Then I've got 2 chest seals here, and I've even got a needle for needle decompression. Now, I carry my tourniquet every day. That's in another pocket. But I don't think there's a reason you can't carry this. Oh yeah, I forgot. I've got duct tape too. Always have duct tape with my kids. But there's no reason you can't carry these things and have this available to you. And this is a small kit that you could put in a pocket, even if you carry a bag with you every day, you know, things like that. If you carry a firearm, which most of you probably watching do, you should be carrying medical. There's absolutely no reason. Let me see here. What I recommend, Benjamin was asking about the tourniquets. A full-size tourniquet on a 2-year-old is probably not going to work, depending on their size. Because by the time you take a tourniquet, and this is just a training one I have, you put this all the way down to a 2-year-old's arm, trying to get that windlass to cut, it's just not going to do it. A Schlissman wrap is what I recommend. I sell them. It's pretty self-explanatory. I don't think, I may have one right here. Hold on. No, I thought I had one right here close. I recommend the Schlissman wrap. That's the best thing to carry. It is you could use it as a pressure wrap. You can use it as a tourniquet for infants. You could also use it as an animal tourniquet. Sorry, I was digging through somebody's order. I couldn't remember if they had ordered a Schlissman or not that I was packing up. But I think the best thing to do is have something for them and have a kit on you or close to you for your children too. Have a purposeful kit for that. You've got stuff for adults, and what your IFAK should be that you carry on you should be for you or obviously close loved ones. I mean, if you choose to help somebody else while you're out, that's you know, your decision. But I think a Schlissman wrap, it's very small, it's very compact. I think it's the best thing for children out today, and I do carry them on my website. Ben, that's what I would suggest. If you want to get a hold of me, I can tell you more about him. The guy who invented it's an ER doc. I deal with him directly. I order from them directly. I'm one of his distributors. We've sold a ton of them. I know there's people here in the chat who have them. My son's in the chat. He carries them for my grandsons. That's why I originally got the Schlissman wrap, was for my grandsons, and I like the product so much and how versatile it is that I called him up and I called the number for the company that I found online. It took me a little while to dig and find the number. When I did, the doctor answered. Dr. Schlissman answered. And I've had several conversations with him about the product, and I really like it, and I started selling it. I believe that much in it. I think Spags has a Schlissman wrap. I believe I sent him one. I know my son does. Jason might have one that's in here. So those are people you can talk to. So just get a hold of me, and we can I can discuss it with you and tell you what would be best. I've got some other products too for kids. I know you know Evan. You can ask Evan. The med bag he carries with him to all of his classes and stuff, I built that for him. He handed me the bag and told me to fill it, and I did. And I put a whole section is in there for his kids, and Schlissman wrap was in there. Some, people were talking about the rat's tourniquet to be, and the problem is with a tourniquet on children is a lot different than a tourniquet on adults. And yeah, we want to stop life-threatening bleeding, but the thing about it is when you put that much force, centrifugal force, as you know, Benjamin, I know you do, on a small area on a child, their muscles, their tissue, their bones is very different from an adult. They're not a little adult. Everything is different. So you could cause permanent damage, and we don't want to do that. Yes, life over limb, I get that, but I'd rather not do that. And with this, it distributes the force over a greater area and still achieves the same thing in the same amount of time. You're not losing time, but you're still doing that, but you're also able not to cause permanent damage to kids. So, you know, I would suggest that, but there's no reason for you not to carry medical every day. As Max from Max's Path said, and we were doing a podcast, if you carry a gun and you don't carry medical or at least a tourniquet, well then fuck you. And it's true. You should. There's no reason not to. There's no reason you can't carry a tourniquet every single day. I do. I carry this tourniquet with me every day. Why do I carry it? It's a soft T wide instead of a cat. I don't know if you can see. Just folds up, thinner. Is it different and harder as far as self-application? It is, but it's also technique. It's a different technique of self-application than a cat than what it is a soft T, and that just comes to good training and somebody to show you how to do it properly. You could get it on just as fast as a cat. I can too, but that's just what I prefer to carry. You know, I think it's important in today's world with everything that goes on, and if you look at what our modern healthcare is, and especially EMS, everybody knows healthcare is in a crisis. Well, that counts on EMS too, and their response times are longer and longer and longer because there's a shortage. There's a greater shortage per capita in EMS than there is in healthcare overall, your conventional healthcare. So keep that in mind and know what your capabilities of are the first responders that are coming to you, your fire department, your EMS. What's your closest ambulance? Are they full-time paid? Are they part-time paid? You know, are they volunteer? You know, how long is it going to take them? And if they're not coming, they're not available, who's the next closest? And then who's the next closest? Because it could be third or fourth down the line that's coming to get you if it's volunteer or whatever, or you've got a smaller system and they're just busy or overwhelmed. So keep that in mind and be prepared and have the equipment on hand to have that. Now, I know everybody that's in here right now, you know, from people I see commenting, has that stuff. But my son, he's in there, he's been training since, I don't know, 5, 6 years old. You know, probably before he could spell CPR. My grandson, who's 7, is doing the same now. They're not too young. I've had as young as 8, I believe, the youngest taking one of my classes, one of my Homestead Medical classes, which is much more advanced than that. So they're not too young to train. I think they should. They grasp it and they've enjoyed it. I've never had a kid sitting in my class who was bored. Yeah, Chase, tell you all about the snake staff tourniquet. It's a new everyday carry. I don't have one here. I'm waiting on them to send it to me. I just became a distributor for them. I've been testing them. I do have one. It's just not right out here right now. And it seems to be, I've never applied it to a person, but I've put a cat on somebody many times. I've put a soft T on somebody many times. I know those work. And there's 29 years of data from the GWAT that backs them both up. But the snake staff tourniquet is an everyday carry tourniquet. It is a smaller tourniquet. It'll even fold down smaller than this one. And that's what kind of interests me. So I started testing it, got a couple. I like them. I'm looking at the wide. They have 2 versions. They have the regular one and a wide. The regular one is too thin, I think, to get proper occlusion. So I'm going to be only selling the wides, making those available. They're going to be about the same, $30, same thing as a cat. So there's no reason now to carry it. It's something you could literally slip into your front pocket. It's smaller and easier to carry, and it's easy to apply. Windlass tourniquet, same basically application as every other windlass. Only thing I don't like is the gate where you lock the windlass down in. It's got a gate that you snap in. I'm not finding, it's technique and it's learning how to do it. I've gotten it down, but it takes a little bit, and it's a little bit different than what we're used to with the conventional tourniquets that we've had. So I think, that's carrying a tourniquet at the least should be done. And if you don't know, if you work in an industrial setting, look at your first aid kits and see. It's now an OSHA requirement that a tourniquet is in those industrial first aid kits in the workplace. And training is given to it. Now, yeah, I know they talk about it in the basic first aid classes, which I think is basically a waste of time now. And yes, I'm an instructor in those. But I think you need more. You need a lot more. And you need to understand the equipment. You need to get your hands on the equipment. You need to play with the equipment so you see what the capabilities are of them. I think that's important. And that goes with any training that you do. Vet your instructors. You know, talk to former students. They should be able to give you references. And tell you what classes are, and you know, should be able to talk to other students so you can see what if it's a good fit for you. I've got nothing to hide. I'll tell you anything you want to know about my classes. I'll be more than happy to talk to you, because you should have that confidence going into your training. Yeah, teaching stroke recognition to elementary kids. Amy B was talking about that. I mean, it's important. These kids can learn these things, and it's important to teach them. If you're not training with your kids and teaching them these things, you should. And I've got kind of a unwritten rule with my classes, my tactical trauma, as I call them, which is, you know, the tourniquets and all the cool guy ninja shit. If you bring your kid, you know, if they're under 12 and under, I'll train them for free. They can take the class for free, and you know, let them turn. Just let them know they're going to be putting a tourniquet on tight. A little different for the kids, but they're going to do it for real. They're going to do the same things all the adults do, and they can do it, and they usually catch on quicker. So what else do you all want to talk about? Is there things that you all want to know medical-wise? I mean, I'm going to talk about hypothermia here in a minute, but do you all have questions about equipment and other things? And the snake staff tourniquets, I'll have them on my website probably by next week, once I get them in stock. I don't like to put anything up that I don't currently have in stock, unless it's stated on there. Has anybody taken any medical training here lately? Have you done anything or looked at your preps, your medical preps, that you checked for holes? I mean, if you haven't, you should. If you're not going through all your preps, you should. It should be something you regularly do, and put a schedule on it. Have a list of everything. Jason's in here. He's got I'm not going to say too much for his operational security, but he's got a lot of medical preps. Pretty impressive with what he has and how he has it organized. And he's gotten more, and the group there in Kentucky. I've gone down there and taught at his place. Yeah, I know. I need to get down there and set up your stock bag, Jason. I will. But you know, you should be going through everything. I mean, I'm sitting here on the workbench. I was loading some mags earlier, just some stuff that I've shot out. I've got some AR mags to load up. I was loading some pistol mags that I use, but I'm just going through stuff. You know, you should have your stuff. I mean, I've got equipment up here, and the reason is I'm going through some stuff. I haven't been through. This is my main bag I work out of when I work events or doing any type of medical coverage. So I'm going to go through this. This is my vehicle med bag. I'm just going through and make sure. I'm going to actually add an extra, and it's something I failed to do at the beginning of winter, just some extra emergency blankets and stuff. And one of the things I keep in stuff, and we'll talk about that when I go in some of the hypothermia stuff, but I think it's important you go through your stuff and make sure you have holes. I mean, I do medical stuff every day, but I still need to go through my own preps. And I keep extra things, probably more than what most people, of course, and I've always got a med bag on me. Besides, this stays in my vehicle, but I've got more I carry with me, that just because it's my nature as a medic. But I think you should be going through your preps, getting stuff ready. You know, it's coming up, depending on where you are, starting, you know, maybe even starting plants already in greenhouses if you have them and things like that. You know, just going out into your vehicle with this weather. Is your vehicle all your other preps and supplies you keep in your vehicle? Do you have daily things you carry? Even your EDC stuff, you know, do you have an EDC bag you take with you every day? Do you have a get home bag? All those things, you should go through it. I go through mine. I keep in a small, one of John's small clothes bags, special operations equipment. I keep a change of clothes, a full change of clothes in that bag in my car all the time. And as you know, the seasons change, I change out the clothing so it's appropriate. But I always keep an extra jacket in the vehicle, a toboggan, gloves. You know, those are all extras. They don't get touched. They don't get used. That's just, if I don't have that stuff with me, I'm stuck somewhere. I know I've got that at least as a backup. I should have that stuff with me anyway to prepare if I'm going somewhere, but I like to have it as a backup. It's just, you know, to me, 1 is none, 2 is 1. All right, Grumpy, we can talk about triage. So triage is, what triage is, it's a French word that basically is to sort. So it's sorting good versus bad injuries. In other words, who needs to be treated first, second, third, and so on. But you can even triage one patient if they have multiple injuries. What's the thing that's going to kill them first, or is the most serious? You know, is it affecting, number one, are they bleeding out? We need to stop that immediately. Do they have an airway compromise? We need to fix that, make sure they have an open airway. You know, circulation, is there something that is, and I'm not talking about bleeding out, I'm talking more of shock. Do they have a injury that could possibly affect their circulation as far as shock goes? We need to keep them warm. And then we need to look at also our environment. Where are we treating them at? Right now, it's cold outside. It's in the 20s here in West Virginia. If I have somebody outside, number one, I want to get them out of the environment. And if they are in the environment, we have to work outside. I'm putting layers down between them and the ground, you know, because I want to insulate them from that. So, you know, when we start talking about triage, you know, on a singular patient with multiple injuries, that's what you need to look at. You know, if they've got a little scrape or a little laceration and it's venous bleeding, it may even be a steady flow, but it's not that bright red arterial bleeding, we know we're okay. We can sustain that and leave that alone. If they have a broken arm, you see an arm going in a direction or a leg going in a direction it shouldn't be, that's distracting to you. Yes, oh, that looks bad. It shouldn't be at that angle. But if they also have an arterial bleed, the broken limb is not going to kill them. The arterial bleed will. You've got 90 seconds. Just remember that. I know everybody's going to say, oh, 3 minutes is what I've been told. Yeah, you'll bleed out in 3 minutes. But in 90 seconds, you'll lose enough blood volume that you'll go unconscious, or it'll affect your cognitive thinking ability, and you're basically dead then. You go unconscious, you can't help yourself. So it's the same thing with another person you're treating. Other things, you have multiple patients, it can be difficult. If you don't see signs of life, you walk up to somebody, they're unconscious, unresponsive, and you don't see them breathing, if you position their head and you take some training, they'll show you how to open their airway up, and they don't start spontaneously breathing on their own, they're dead. And if you have other patients you have to take care of, that's just the way it is. And I know that's not an easy thing to do, but that's just the truth. Do you want to use all your resources trying to save this one person when you could save 4 more? And if you don't immediately treat them, they are going to die, and they're viable patients. In other words, they have injuries. Yes, that could be life-threatening, but you can stop that, and they can become a viable living patient where this one's not. So that's something you have to think of. So think about the things that could kill them in 5 minutes or less. Arterial bleed, a penetrating chest injury, something that you're going to have to use, you know, a chest seal on that we want to cover with a commercially made chest seal. Cover that up so that air is not going into their pleural cavity to where it's going to start affecting their mechanical ventilation to where they're not able to breathe, which will also kill them, which will also stop the heart, which will also stop the brain. And once the brain stops, everything else does also. So that's just kind of the things you do. All the other stuff you can be treated later on. But you also have to think about shock. Shock may not kill them right then and there in a couple of minutes, but 10 minutes down the road it can. And if they have an arterial bleed or they have a penetrating chest wound, they're going to go into shock because that is affecting the mechanical workings of the whole body. So you do need to stop that. You need to fix it. So you need to keep them warm. That's why carrying these emergency blankets, I know it may not look much, but you put this on, it radiates their heat back. It will keep them warm sustainably. And if they're operating at that 97.8 degrees, the body's operating at that optimum temperature within, you know, it's going to heal better. It's going to respond better to treatment. What else do you all want to talk about? That's my quick, down and dirty version of triage. If you take one of my classes, the Homestead Medical course, the 2-day course, we go over patient assessment. We go over triage pretty in detail, so you can recognize these things better. And it's just, again, it's skill and knowledge. It's not rocket science. I can teach you the skill and knowledge. It's honestly not what our medical society now has made it out to be. Yes, doctors and nurses and me as a paramedic, you go to a lot of schooling, and throughout the years you take a lot of training, but it's basic stuff that I've just kind of cut out a lot of the, I don't want to say nonsense, because pathophysiology is important and all those things, but show you what you need to do right then, right there for this particular type of injury or illness. We talk a little bit about hypothermia since we were talking about shock. So it's cold out. Does anybody know or can tell me what are some of the first signs of hypothermia are? Or any signs besides frostbite and things like that. What are some signs that you know of that you can recognize for hypothermia? So first thing you're going to do is obviously cold. You're starting to feel cold. You're out in an environment and you're working, you're starting to feel cold. So how do we get cold? Well, there's different ways we lose heat from our body. One is our exposure to the air. You know, are we not dressed properly? So that's evaporation, all right? Sweating is evaporation. Yeah, Grumpy just said sleepiness because it affects your cognitive thinking, your level of consciousness, and we're going to go into that in a second. So you can lose heat through obviously not having the proper clothing on and through evaporation. One of the biggest areas of heat loss is your head. If your head's not covered, you're going to lose a lot of heat. You can have all the greatest clothing on in the world, but you don't have something over your head, you're going to lose that heat. Hands and feet can also, you can lose a lot of heat from that. Also, your hands and feet are going to get cold first because why? It's not because they might be more exposed, your hands don't have gloves on. It's the farthest point away from your heart, from your body, from the central core of your body. Remember, the blood warms through oxygenation and going through your body, that carries heat through it. So they're the farthest points away from your heart. Time it gets there, so it happens. So they will become cold first. And like I said, you can lose a lot of heat through your head, so obviously dressing appropriately for it. You'll also probably notice, before you notice like the sleepiness and stuff for your cognitive abilities, is dexterity. Your hands, you'll just notice you won't be able to start losing some of the fine motor skills. When you're walking, your feet might feel a little numb or something. It's a good chance. So what we think we got to do, oh, I'm going to sit down and rest and do that. Well, maybe that might help. But what are you sitting on? Because then, guess what that is? That's convection. All right? You sit there, you're convecting that heat. So in other words, you sit on the cold ground, guess what happens? That cold ground is going to suck the heat from you, and you're going to get that cold, so you need to have barriers in between. Sitting on a chair, and even if you say, oh, I'll sit on this rock, well, rocks are cold too. Some sort of physical barrier between you to prevent that from happening. You know, the other one is convection, and convection is just that wind blowing. It's when the wind is blowing through you, get a so one way to just battle that is simply get out of that environment, find a windbreak somewhere. Where Grumpy is out in Kansas, good luck, it's pretty flat. But even if you're out, you get behind a car or something like that, you know, if you're obviously it's in a car, you can get in it, but you want to block that wind, get behind some trees, some rocks, something that's going to block that wind from blowing over you, because that's going to take heat away from you. So, you know, all these things are important to do. So prevention is the biggest key. You start getting cold, get out of the environment, warm yourself up. You're outside, get to a heat source. Get out of the outside if you can, but if you're not, build a fire. It's that simple. If you don't know how to build a fire, that's, you know, other classes, other things, but you should have that ability with you anytime you go out. No matter what type of it is, you should have a bag and you should have some supplies with you. obviously a med kit, but you should have things of making a fire. You know, I carry a lighter with me every day for that very reason. Have a knife, have that so you can gather materials, whatever it is, to build yourself a fire to heat your body back up. A lot of people think, oh, I'm cold, I could drink some alcohol. Absolute worst thing you can do. It will make you colder, because what does alcohol do to you? What is the physical response of alcohol into your body? What happens? It thins your blood. You thin your blood, what happens? You get colder. You know, do you have any loved ones or yourself or what that's on blood thinners? You'll notice you get colder easier. That's why your blood is thinner. So that's what alcohol is going to do. Warm beverages help. They do. You know, and one of the easiest things to do is carry those pocket warmers. You know, the hand warmers. The chemical stuff, carry those with you. Carry just a couple and warm in your hands. But what you could do is you could take those and put them underneath your axillaries where you have arteries, and you can warm in your kidneys, because guess what? All the blood goes through your kidneys. You could put them on your flanks and put them on there, and that is going to raise your internal temperature, and that's what we want to do. We want to get that temperature up to that ultimate, you know, operating temperature, which is 98.7. Spags probably does like that silver bullet to warm up. The other thing is, carry little things with you, like one of these emergency blankets. You know, you should have it. There's no reason not to have this. Carry them with you. And I think it's important that you have it. You know, I like to use these. These are a little bit thicker. From North American Rescue. This is one of them. Of their just regular space blankets. I like to use thicker ones. Another great resource is from Soul. Is these blankets. These survival blankets that they carry, and this is, I don't remember the exact measurements, but it's enough for two people, costs they're thicker, a little bit heavier, it goes in and it warms you up. I keep all of these in my med packs, and you know, my vehicle med bags. There's one in here. I keep one on this pouch right here. I've got blankets in there, but I keep these because I can cocoon somebody up. And the thing is, you don't want to just drape a blanket in front over top of you like you would like if you're getting in bed. Wrap yourself up in it. Cocoon, make a burrito. If you're trying to warm somebody up, wrap them up like a burrito, and that's going to raise their internal temperature. But remember, and it's right here on this package, cover the head too. Leave a little space right there to breathe, but everything else should be covered underneath that blanket. If you got toboggan, put that on them too. And if they're really cold, and they've gotten to the point of shivering, you notice that they're confused, they're sleepy, that stuff. The biggest thing, it's the old wives' tale, body heat on body heat. That skin on skin contact will do it. Strip down the clothes, get in there. Now, obviously, also environment, and we didn't really talk about it. If you have wet clothes, somebody gets wet, it's cold out, strip those clothes off, get them dry, get that water off their body, and warm them up. A lot of times people don't realize hypothermia happens more when it's 45 to 55 degrees with a slight breeze and somebody gets wet, like it's out and it's raining, whatever, or they getting water for some reason, and they get out and there's that slight breeze. That will drop your temperature quicker than it would be standing outside in 10-degree weather if you have a jacket and moderate layering. Jeremy's in here. Jeremy, how are you? And yeah, North American Rescue, I'm going to have some. I've got some coming. I'm putting them on my site. I'm adding some more products. They've got a hypothermia kit. Has heavier blankets. It has active rewarmers in it. I've got some for me. I've got a product also that I sell called the Blizzard Blanket, which is kind of like a sleeping bag that you get in that is of this material but a little thicker and will warm up, and you can actually, it's got pockets in it where you can put the hand warmers inside that to raise that temperature. Another thing is, if you're able to warm water, put hot water in a water bottle, just like a Nalgene bottle, and stick it down in that bag or sleeping bag or something like that with them. You'd be surprised how much that will warm up and raise somebody's temperature and warm the patient. Other things, you know, for that is hydration. If they're also dehydrated and hypothermic, it's bad. Your body needs to have that water within itself to feed the brain, the heart, and all the central core. So make sure that they're hydrated. But remember, we don't want them to gulp water or anything. We don't want it obviously ice cold. Try to warm it up. If the water is cold, stick it against your body, warm it up, put it under your jacket, get it warm, and give it to them. Hot fluids is good. Caffeine, not the greatest thing to do for them. It's also not great to give caffeinated beverages to somebody who is hypothermic because of their body heat dropping, the heart and the central core and the organs aren't working properly. So what happens is the heart can become slightly unstable and you may have some irregular rhythms. Adding caffeine to it can add to that irregularity of the heart, and you could cause them to go into arrest or having chest pains, a heart attack, stuff like that. Now, kind of slim, but if they do have a cardiac history, those chances increase greatly with that. So just keep that in mind. The caffeinated beverages, alcohol, those aren't great. Doesn't matter if it is warm. I mean, coffee's great. I'm drinking it right now, but it's not, those aren't the greatest things to give. If you can warm up water, those type of things, that's the best thing to do. Easy on the electrolytes, and then also nutrition. Have them eat. Have they not eaten? Are they fed? Because remember, that energy that is brought in from food is what fuels our body, keeps our body going. If it's low energy, the body can't produce the heat, and your hypothermos layer, your in your body, your skin, you know, is your thermal regulator of your whole body. Your skin is an organ. It's your largest organ. So if it doesn't have the energy, it doesn't have those glucose stores to work harder, and it's going to work harder because the body's trying to regulate and try to fix what's wrong, then, you know, you need to make sure that they're fed well too. They've got nutrition. So carry things like, you know, protein. That's the important thing. You can carry jerky, you know, whatever it is, Slim Jim, stuff like that. I mean, I always have stuff like that with me. Here it is. I'm just taking it out. I keep these in medical bags. It's just straight protein that I can feed somebody on something like that. That if they're not, I know. Now, if they've got low blood sugar also, that, you know, we need to get some sort of carbohydrates and some sugar back into them. Obviously, this isn't going to do it, but I do have those things too, some glucose tablets, things like that, or oral glucose to help that. But all these things are things you have to think of. It's not just, oh, they're cold, let's put a blanket on. You know, what's their blood sugar? Are they dehydrated? You know, have they ate? All these things play a role in it, and previous medical history. Yeah, water. If you can get them into warm water, not hot, it's just the same thing if somebody is overheated. Everybody wants to put in this ice cold water, tepid water, room temperature water, wet towels can do that. But if they're cold, we don't want to use hot water and soak towels and put it on them, because obviously that's not going to help. Getting them into a warm shower, you know, something like that, a warm bath, will absolutely raise their temperature up. But you can't be too hot, just warm, you know, enough to where if you put your hand in it, it's comfortable. So what else? Do you all have questions on hypothermia, cold injuries? And like I said, it's not something we think about, and we don't plan ahead for these things, but having that, do you keep a blanket in your vehicle in case you get stuck somewhere? You know, those type of things. I've got a wool blanket in mine right now. I've also got a small, compact sleeping bag. And then I keep a couple of these in there, and I've got tarps. If you keep just a regular tarp, will do the same thing almost as this, and especially if you get the tarps that have the silver lining on one side, just get that. You can get a 6x8 tarp and fold it up real small and keep it in a vehicle, and you could use that as a blanket if need be. And it's also a great blockage or an insulator between you and the ground. And you can use it as a shelter if need be. Yeah, Wubby blankets. You know, I've got, if you've got your Wubbies, you have the military poncho liners. I've got several of those. I've got one in there right now. They compact fine, compact down pretty fine and small. That's what I keep in there. I keep a wool blanket, and I've got, and the same person who made the Wubby blanket that I have, they make a small, what they call a jungle sleeping bag, and I keep that in there, but it'll actually protect. I know you think jungle tropical, but it actually is rated down to about 35 degrees. But it's real small and compact, and I can put it in basically a plastic locker I've got in the back of my Tahoe that has that equipment and stuff in it, along with the other typical stuff I keep, jumper cables, or well, my jump box and things like that. Yeah, just what Jeremy said about the tarp blankets, mylar blankets. You know, remember, one is just one. And, you know, you may, and you're going to think, well, I'm in my car, I've got shelter. You do, but you may not be able to run that vehicle. And you got to think about carbon monoxide. Likelihood's pretty low, but, you know, how much gas do you have? How much fuel do you have to keep the vehicle running to heat it? You know, and it just comes back to common sense survival stuff. In your vehicle, keep food, keep extra water, all those things, because you're going to need that if you get stuck somewhere when you're out in a snowstorm or whatever. How often do you read? It happens all the time. A big snowstorm comes on, people get trapped for hours, 12 hours, 14 hours on interstates. They don't have anything, and you'll see people die or they get sick, and emergency services can't get to you. You're stuck. You're on your own. Yeah, like Jason said, insulated overalls and a heavy jacket. You know, keep an extra jacket. You can get the little puffy jackets that form up. I just got this past year, I bought a couple of outdoor research jackets that are lightweight. They compact down real small, but I'm wearing them as a winter jacket. I mean, today I got warm. I was wearing this hoodie, zip-up hoodie, expedition hoodie from SOE, and that jacket over it, and I had it zipped up. I had to unzip it because I was actually getting too warm. When I was outside, it was like, I think, 28 degrees. So, you know, good quality clothing. I mean, it's like everything else. You get what you pay for. You know, but keep gloves, toboggans, things like that in there. Keep those hand warmers. You know, the chemical activated hand warmers when you crush them up. I'm telling you, those things are a huge lifesaver. I keep them, they're in my bags now. I keep them in there for that very reason. And like I said, you could put them on under your armpits, on your kidneys, you know, on your flanks. You can even put them down on just below basically your groin on each leg, that femoral artery. You put a few of those on there, you're going to warm up real quick. Put one on the back of your neck. I wouldn't suggest putting them on your carotids because you can heat that up too much, and it could affect the blood flow to your brain. But you can put one on the back of your neck, and it's going to help warm that area up to where you're warming all those major arteries. It's going to feed through your body and warm you up and raise your temperature. Yeah, and what Chase said, keep warm clothing for all the members of your family. You know, have basically a go bag that just stays in your vehicle, you know, that has these things, and then, you know, be prepared. Have food, water, all those things. I keep extra medication with me, the medicines that I take, everywhere I go, and I don't touch it. That I keep in my EDC bag. I keep 5 days worth of medication, and that's not just because I'm expected to be stranded somewhere 5 days. It's just in case, or if I ever get delayed traveling or whatever. I know I always have, and when I do travel, I always take a few extra days of medication with me. But I also have that as a backup, and I keep another EDC bag that stays in my car, and that has extra medication. And then I have my get home bag in my car. Yeah, thermal bottoms. I mean, that's just layering, Jeremy. That's smart. I keep in the wintertime in small clothes bag from SOE. Like I said, I keep a full change of clothes and extra socks in that. And that stays in my vehicle year round, and I change it out as the seasons. And right now there is, you know, a pair of thermal bottoms in there just in case somewhere I am, with a pair of pants, even an extra belt. t-shirt, a poly top, long sleeve top, and then a fleece top to go over that, and then I have an extra jacket in the vehicle. Yeah, Chase said the day packs, meaning John's day packs, but any bag. It doesn't matter. It doesn't even have to be a backpack, but just some sort of bag that carries the stuff. I mean, obviously, if you have a get home bag, that probably should be a backpack, and just use what works for you. Just make sure it's a good quality one. It's not going to fall apart on you. And you got to check this equipment. Remember, temperatures, range. Remember how hot, especially in the summertime. You got to be very careful about what you leave in your vehicle. Even where you park your vehicle, you're going to leave this stuff. Try to park in shade. You don't want to be in that direct sunlight and stuff. You may want to crack your windows a little bit to vent it. In some vehicles, you can set the alarm to where it'll automatically start up and cool the interior down. On very hot days where the interior reaches certain things. So just make sure you're always, once a month, once every couple of months, check that equipment in your vehicle. Once a month would probably be better. And that's what I try to do. There's times that I miss it, or it might go 6 weeks, but I try to do once a month to check all those things in my vehicle, get a home bag, all those things. Other medical stuff we talk about, it's all these things. I think it's important. Everybody knows I'm very passionate about this, but it's the long-term care. It's the prolonged care that you're going to have to do after you stop the bleeding. What do you do then? And do you know how to take the tourniquet off? When to take the tourniquet off? What the proper steps are? How to take care of that wound that you may have to take care of for 2 hours, 2 days, 2 weeks, 2 months, whatever it is. Do you have those supplies? Everybody knows I joke around, but I'm not joking when I say it. You don't have enough gauze. Whether it's rolled gauze, you've got gauze pads, 4x4s, 2x2s, you don't have enough. Buy it by the case. I sell them by the case. Buy it. Keep it on hand. It's not that expensive. I think a case of this, which is, and they call a case 80 of these, and this is a 5x9 trauma pad. I think it's $40. I think it's, I don't remember, 40, maybe $50 for a case of rolled gauze, which is, I think, 96 rolls. It's on my website. You can look, homesteadmedical.us. But you don't have, just a little bit of a time. Set a budget, whether it's $10 a week or whatever it is, $25 a month to spend on stuff. You can buy a lot of medical stuff, things like gauze, quite substantially with that type of money. Obviously tourniquets, things like that, but this is $30. I mean, $30, is that not worth, how much is a funeral? And I know people say, oh, the $10 Amazon tourniquets. Well, if you don't know about that now, then, I don't know what to tell you. It's $30. Buy it. It's going to save your life. These heat sheets, the survival blankets, are, I don't know, $6-7. I mean, I sell these, and these are a little bit thicker, a little bit better quality than your normal Mylar blankets. I think I sell them for $2 a piece. I believe these more heavier ones are $4 or $5 a piece. It's not that much to be prepared and have all those things. And there's no reason to carry. I mean, I talked about this carry, but I also have, I forgot, I'm sitting here, my ankle kit. This is Special Operations Equipment ankle kit, and I hated ankle medical kits. I did. I never found one that I liked, and I talked to John, and he had some. He played around with them and kind of told him some things. He asked my opinion on some stuff, and this is the only comfortable one I found. There may be ones out there now that I haven't, but I've tried most of them, and they just weren't comfortable. This isn't bulky. It doesn't have outside pockets. It's all, elastic pockets that you can slide things in. Keeps it slim. You can put it on, your ankle and carry it. And I know people may talk shit about it and make fun of you, but fuck them. Who cares? You know, if they want to be stupid and they're not prepared, that's on them. They don't want to save their family, that's on them. You know, I don't want to say you're a grown ass fucking adult. Be prepared. Have that shit prepared. I mean, and again, if you carry a firearm every day, you should be carrying medical. And as Max says, if you're not, fuck you. You're stupid. Yeah, the Amazon tourniquet. Chase is reminding me. I taught a live tissue class. Yes, a live tissue class. You want to know more about it, contact me offline. A couple weeks ago, and I purposely use them, and anybody's taking my class, I'll have some of those cheap Chinese tourniquets. They're $10, you know, and I'll buy them just for that point. I'll say, here, use this. Somebody's going to break one. You'll break it, and they did. We broke actually two. We broke a rat's tourniquet too. So that's why windlass tourniquets, you know, that's why I sell these. 27 years of data. Not talking shit about rats or anything. Something is better than nothing. But we did, you know, break a rat's on it. Now, it had been used, I think, applied 2 other times. It was the 3rd time used. But, you know, I've never seen one of these break. And I've got some that I haven't trained that have been applied hundreds of times. Smokey's talking about he's got cold weather kits, which is great. I mean, you should. Again, you're an adult. Think. You know, don't be one of the sheeple. Don't be the people that always they think, oh, somebody will come and help me. The government's going to come and help. I mean, you wouldn't be here. We wouldn't be in the same circles, the same community, if you thought like that. And you see it every day. You know, people just aren't prepared, and I don't understand it. It takes a few extra minutes. You know, instead of buying that gross-ass Starbucks coffee that's bitter and tastes like shit and costs $10 for a small little cup, Muka Luka, whatever they are, spend that $10 on some preps. You know, buy some blankets, you know. You know, if you don't want to buy a real wool blanket, and they are kind of pricey, get a fleece blanket, a heavy fleece blanket. Those will insulate you well too. You know, just have something, prepare a little, and for whatever the case may be, and don't think, oh, well, it's never happened to me. Well, just because it's never happened doesn't mean it won't. Most people who I've matter of fact, all the people I've ever put a tourniquet on, they've never had a tourniquet applied before. They didn't plan on that happening to them. You know, people don't plan on that. So, you know, just be prepared, think ahead, plan ahead, have a pace plan. Yeah, Chase said, and it's the same thing. That's why I've got some of my stuff out here. Your kits change per season, per mission. My medical bag, and well, there we go, a little mud on it. That's what happens when you actually use your gear. You know, these SOE bags inside probably explode because it's packed. You can see that it has these tearaway mesh pockets. You know, it's Velcro on the inside, these mesh pockets, and I've got them labeled like this one's airway chest. I can change that out, and I keep modules, other mesh pockets, depending on what I'm going to do that'll fit that mission. Instead of repacking a whole thing and everything, I've got ones that are already set up for certain things that I can just throw in there. And for different bags that I carry with me, this is the bag I'm going to have on my back, and I can do minor surgery out of this bag. But I also have the MCAB, the bifold tool carrier, which I know it's a tool carrier, but I use it for medical reasons. I've got different things in that I can switch out. My vehicle med bag pretty much stays the same. That's pretty much there to treat trauma, because that's what you're usually going to deal with in a vehicle, or you drive up on an accident or in an accident, that type of thing. But I could change it out as doing, and then just same thing with your equipment. It changes as the season changes. And, you know, have that extra equipment. You know, you think, oh, I've got one tourniquet. Well, guess what? One tourniquet may not get the job done. I keep 2 tourniquets, my vehicle med bag. I've always got a tourniquet on me. There's a tourniquet on my visor cover. And then I've got other med bags. I mean, in my vehicle alone, what's on me, what I carry with me every day. I mean, in my EDC bag, both of those, I've got a tourniquet also. One on me, the two here, the ones in the med bags. There's 4 tourniquets here. There's 2 here on the outside, 2 on the inside. My other med bag, there's 2 tourniquets in it. I'll have, at the very least, half a dozen, 10 tourniquets with me. That's just me as the paramedic, but again, 1 is none, 2 is 1. You may need to apply a second tourniquet because that first one may not, because you have such a large wound, occlude that bleeding. You may need to apply a second tourniquet. Or, nothing is to say that there won't be 2 arteries taken, like both your legs or an arm and a leg. What are you going to do? Yeah. Show you how to stage a tourniquet. So, this is one of the Recon, or what are they, Rhino now, tourniquets. So, you can do them a couple of different ways. What I like to do is, your tourniquet's going to have Velcro on one side. And that's what, your windlass, when you pull it tight, it's going to secure it, and then you're going to start tightening your windlass. So what I like to do is, number one, I take this tab, and what I do is I'll fold it over like this, the red tab where it's on the end, so you get more of a purchase point. Because if you've ever noticed, especially if you have gloves on, your hand can kind of slip out. By just folding it down 1.5 inches, 2 inches, you've got kind of a stop, and you're going to get more of a grip and a purchase point when you go to use it. I just like doing that, something I've always done, and I can still, if need be, I can feed it through, or you could just, if you've got to take it off, you're going to put it around the leg, just undo it and take it through. So what I do is I take about, usually I'll keep a loop that's going to be about the circumference of what my leg is. My leg is bigger than most, but I'll keep about 8 inches or so, fold it out, pull it through the tourniquet ready, and then I'll fold it over the Velcro. So you can kind of hold it up where you secure your windlass like this. And what I'll do is, you can fold it, there's a couple different ways. I'll take this, and where it naturally is, where the buckle is, I'll let it fold like that. So you've got it, and you've got it here to where your windlass is. You tuck your windlass in here, into the tuck, but make sure you fold your time tab back on. You don't want it across, because that's just one more thing that's going to slow you down getting the tourniquet. So have it like this, it's upside down, your buckle's up top, and you'll see that's a soft part that's non-Velcro. And then I'll just fold it up like this so you can have it, and then you could take, I know I've got a rubber band around here somewhere, a rubber band, and just secure it around, and it's ready to go. Now some people will do it a little opposite, to where they'll fold the Velcro here and go and fold the Velcro on itself to where it's like this. The reason I don't do it is, when you go to do it, and if you have to do it one-handed, that Velcro sticks. If you do it the way I was showing you, to where you fold the Velcro back over the soft part and you rubber band it, you can take that rubber band, even with your teeth, and break it, and then your tourniquet just falls and it's ready to go, and then you can, just that quick. So that's why I stage it that way. Yeah, if you keep it in a pocket and it's not in a carrier, can you get some stuff on the Velcro? Yeah, just watch it, see what the wear and tear is. I mean, I don't store, I keep this one in my vehicle, and I've got it on a quick thing, but this stays in my vehicle, and it stays out of the sunlight. I've got it covered so I don't have UV breakdown or anything that's going to hurt it. And I check it and change them out. My other tourniquets, like here in my bag, they're in a tourniquet pouch to protect them. The one I keep in my pocket is a little different, and I've got it folded different. But this one doesn't have Velcro on it. The soft tee doesn't have the Velcro like the cat. You can get sleeves and stuff like that, but if you keep this in your pocket, that's just the proper way. I just think it's easier to do it this way with the Velcro on the outside, because you pull that rubber band and boom, you're ready to go. It's that quick. Instead of, other people will show you, and there's 20 different ways to stage a cat tourniquet. Like this, you have this, well, a lot of people say, oh, well, you can just pull it and go. Well, what if you can't use this arm? You might be able to grab it with your teeth and everything, but I would rather just open it up to where it's ready to go. That simple. Yeah, Smokey was saying he likes the SOE bifold tool bag for a truck med kit. Yeah, it does. They have the same mesh pockets in it, tear off, and it's a nice thing. I actually got one that I use for just strictly a wound care kit that I take with me. I can hang it up on a wall. I can do an instant clinic with that and the MCAB, and that is just all strictly wound care stuff, from whether it's minor stuff to where I may just need to clean out a wound and then dress it. I may put steri strips, butterflies, a zip stitch, or I've got a staple gun in it and everything, and I can do gross decon on the wound to get it cleaned up before anything, or if I have to pack it. So I keep one of those for that, but I know a lot of people, I just sent somebody a fill kit, and that's what they're using. They're using a bifold toolkit as their basically vehicle med bag. I mean, John makes the vehicle med bag. I like it. You know, it's organized. You've got loops. You know, and I carry, you can see there's a lot of stuff in here. I've got a fill kit on my website. It's the vehicle med bag fill kit that comes with all this stuff. You can read what the contents in there. I've got them for his compact tear off kit. This is one of the training ones, but I've got a fill kit for this. I've got several different types of fill kits. There's wound care kits in there, basic and advanced, that you keep at home, and that's to treat many different types of wounds and for long-term wound care. I've got a splint kit, I've got a burn kit, all those. I mean, people don't talk about that. You don't see that. I keep burn materials in my vehicle med kit because you could come into them. A simple thing like just burn gel for minor burns, but I also have burn dressings, one of these burn techs that I sell on the site also, or you can just buy one of the burn kits. I'm actually getting patches made, Smokey. So, you know, what other questions do you all have? We've been going about an hour. I was going to try to keep it about an hour, but we can go as long as you want. What other questions do you have? What else do you all want to know about? Or hell, we can talk about anything. Yeah, Benjamin. I had, most of you won't know with this, I was in the hospital for over 5 months in Dallas, Texas. And I got to know wound care nurses really well. Benjamin will know about this. Some of you may not, and I can tell you offline. But I was in the hospital for necrotizing fasciitis. I had it in my right leg. I had an open wound that had to be cleaned, debrided several times a week, and it was dressed in the beginning a couple times a day, and then it went to one time a day, wet to dry dressings, and it was cleaned every day. But wound care nurses came in every day and took care of me. I was in ICU for 3.5 months. I almost died 3 times. I'm not doing this for a thing. I mean, my son's in here. He can tell you. He got a phone call from him telling him I had 24 hours to live. I was in multi-system organ failure, complete kidney failure, complete pancreatic failure, respiratory distress. I was sick. I was deadly sick. I'm lucky I'm here. Very lucky I'm here. But wound care, that's where I got really interested in long-term wound care, because I was watching them work on my leg every single day. And what it took and the amount of supplies and everything, it's got me thinking about this. But yeah, Ben, I think it would be a great idea to go do, a wound care specialist. It's kind of a niche, and it is needed, and more you're seeing people are being sent home for home care instead of being kept in a hospital. So I'm sure there'd be no shortage of work for you. So what, I don't know, is Jason still in here? He's old. He may have had to go to bed early. What else do you all want to talk about? You're seeing things that are going on in the day. There are shortages of some medical equipment. They're still sending trauma supplies over to Ukraine. Now Israel. I mean, Israel's pretty well stocked anyway, but that stuff's going there. Getting 14 gauge decompression needles. These exact needles are almost impossible right now to get, and have been like that for months and months. Yeah, people are going home with wound vacs, drains, Prismo drains, all those things. So, you need to know, and I go over these things in class. So, that's why I say get the training, take the extra classes, because you don't know when you're going to be taking care of a loved one. And if you don't know how to properly take care of that wound, it'll get infected, they'll get septic, and they'll die. It's just that simple. You don't believe me? Ask Ben. He's a nurse. He works, I believe, in trauma now, and he'll tell you. I think he's a travel nurse, but I think. Are you a travel nurse, Ben? Can't remember if you are or not. But he'll tell you, healthcare is in a crisis, and it's not going to get any better anytime soon. So you're best be prepared for it and have the supplies to do so. Yep, I'll say, and I do custom kits. Just because you don't see something on my website that you want or that's fitting your need or what you think you need, just email me. It's chuck@homesteadmedical.us. Email me and we'll talk about it, and I'll build you custom kits. If you see something in a kit that, I don't need that, or there's something else I want extra, just let me know and we'll build it and we'll talk pricing and stuff like that. But I don't charge extra to build you a custom kit. It's by what is in the kit. Yeah, okay, I knew you worked in trauma. I couldn't remember if it was the ER, if you actually worked on a trauma floor. Trends and liability with wokeness and Karens. You're going to have people who are going to say, oh, you can't do that. I get it all the time when I talk about stuff on videos and some of the stuff I've done. I've gotten the haters, mostly from the medical community. You can't teach that. You can't teach them that. Yeah, I can. There's nothing that says I can't teach you. I can teach you anything. I can't certify you in it. I can't certify you to go out and open up Joe Blow's wound care clinic. But what I can show you and pass knowledge on, and we could do it for informational purposes only, and what you do in your own damn home is none of my business. But I think you should be prepared. So I do get some haters about that, and I get a lot of haters from the medical community because I say it's not rocket science. Yeah, I mean, I'm not going to teach you brain surgery. I'm not a neurosurgeon, but I've got a pretty wide, extensive career in EMS where I've worked your traditional EMS, on an ambulance and worked my way up through the ranks. And I've worked in austere environments. I've worked in different countries. So I've been in places where I was the only type of medical care. I was the doctor, so to speak. So, and I'm an advanced practice paramedic. It's an overseas recognition, but I did get that. Austere paramedic. I'm a critical care paramedic. I've just passing on knowledge and things I've learned, and I've always been a student of trying to learn more, do more, be more prepared to take care of patients, and I've always taught too. I've taught for almost 25 years, and I enjoy doing that, but I've got a real passion for teaching this particular stuff of prolonged care, austere care to people, and because I think you should be prepared, and I think it's a big gap. Most people don't want to spend the money on medical. They don't want to take the medical training. They want to take the cool guy ninja shit and go shoot guns and stuff like that, or they want to go with the big YouTube names. And yeah, you're going to pay for that, having those big YouTube names. And I'm not slamming anybody before anybody gets any ideas. But you may go take a big trauma class, and you don't want to take classes from me. I'll tell you who to go take it from. Refuge Medical does excellent training. Bear and his group, they do excellent training, but it's on trauma. They don't really go into prolonged care, and I focus more on what are you going to do after all that stuff. And it's not knocking them; they just don't. It's just not what they offer. They offer equipment stuff you can buy that has some extended care stuff and some wound care stuff in there, but you need the training. All that equipment is useless if you don't know how to use it. Yeah, they like to gatekeep. You're exactly right, Benjamin. That's what it is. And it's not. I mean, yeah, I spent a lot of time in school. I spent a lot of extra time training and taking continuing education. And Benjamin can tell you too, constantly doing that. But I try to cut through a lot of the mumbo jumbo scientific stuff just to show you the skills and knowledge you need to accomplish those tasks when you find whatever it is, XYZ, this is what you do to take care of it and how you treat it. Yeah, you're right, Amy. I'm very fortunate. I can't tell you. Obviously, God had different, still wants me to be here. Maybe this is why, is to pass this knowledge on. But I'm very thankful. I was by myself in Dallas, Texas, and it was in the middle of COVID. So that's when the hospitals were all locked down, travel restrictions. My family was back here in West Virginia. And I still, to this day, feel guilty because my son and my parents got a phone call telling them I had 24 hours to live. If you look at healthcare now and the state of it, there is a lot of your wait times going into the ER. You walk into an ER now in your area, how long are you going to wait? I mean, Benjamin's outside of San Diego, big metropolitan area. It's probably going to be hard, but even where I live in West Virginia, and we're in a fairly large city, second largest city in West Virginia, and it's in a metro area. The largest city is only 40 minutes away, Charleston, the capital. We've got 2 trauma centers here, but you walk into an ER, you're for something even serious, you're going to be waiting 8-12 hours just to get a bed. And then who knows how long you're going to be waiting in the ER just to get a bed if you become an inpatient. Yeah, 6 hours for non-life-threatening injuries. So, and then you can start looking into, clinics and I call them doc in the boxes, urgent cares, things like that, to go to. But even though they are overwhelmed and it's longer wait times. And here's the other thing, and I'm not knocking nurses at all. I have high respect. I've got a lot of good friends who are RNs. Travel nursing has become very popular because you get paid more money, and I don't blame somebody for wanting to make more money. Problem is you don't have that home. They go into, they're not familiar with the system, they're not familiar with the way things are done, and a lot of more mistakes, medical mistakes, are happening because of travel nurses. They're not familiar with things. They're kind of thrown to the wolves almost in some places, figuring out stuff on the fly. So, you've got that to contend with now in modern healthcare. Yeah, Amy's talking about she tried an urgent care and was turned away because they were full. And that's the other thing. Amy mentioned herbs. It's very important that you start looking at herbal remedies, tinctures, natural remedies, things like that. I don't talk a lot about it because I'm learning more about it. I'm not one who wants to teach something that I don't feel like I should be teaching because I don't have the knowledge. And when I say knowledge, not just book knowledge, but hands-on physicality knowledge of using them, of doing. But I am learning. I'm learning from people and learning all about it because, if the world, for whatever reason, the shit hits the fan, and for whatever the reason is, medicines are going to stop. Look what happened to COVID. If you look during, I said the C word, excuse me, I'm not allowed to say that on YouTube. But look what happened during that crisis. Things were shut down, including big pharma producers, medicines and stuff. So there's a lot of alternatives out there. And think about it. How did humans live before there was big pharma? Same stuff. You're kind of going back to that old stuff. Honey is still used to this day for wound care. To this day. They still use leeches for wound care to this day. So obviously there's benefit to it because in our modern medicine, that's what's being used. And honey's been used for thousands of years for wound care. Yeah, you're talking about you're taken to the ER by ambulance. Guess what, folks? That doesn't automatically guarantee you get a bed. I've been a paramedic 29 years. I can't tell you how many times I transported somebody on a stretcher to an ER, and they went to the waiting room, dropped the cot, had them hop up and go because they think if they call for an ambulance, they're going to get in quicker. No. And I've taken patients who couldn't go to the waiting room, and they've been put in a bed and stuck in the hallway in the ER because they're full, who are legitimately sick patients. I've waited in line just to get a hallway bed, patients still sitting on my cot. I'm literally giving meds, seriously ill people, unstable heart rhythms, things like that, and I'm pushing meds, standing in the ER with doctors and nurses walking by, actively treating the patient. I've helped intubate a patient standing in the ER waiting on a bed. Yeah, as Benjamin said, they have sterile hospital leeches and maggots, and that's true. They do. They're still using it to this day for wound care. Yeah, I mean, you see how they're treated. Everybody's probably got a story of what conventional healthcare is. So keep that in mind. That's why you need the training. That's why you need to stock up on the supplies. And I'm not saying it because that's what I teach, but I am saying it. Of course, I want to make money, but I also want to see you be prepared. That's why I saw a hole in the industry. Everybody was teaching tactical trauma, and I do too. All the cool guy ninja shit, but nobody was teaching what do you do after. What do you do once you've stopped the bleed? Well, there's a lot of shit you have to do. What else? Any other questions? What else you all want to talk about? I don't care. It doesn't have to be medical. We can talk about anything. Sorry, I'm not going to constantly pace like John Willis does on his live. I don't have a gym and a big factory floor. I can walk circles in the garage. Yeah, Chase talking about building mag groups. Build community. Have a community. Have a few of you. You may in your community have nurses, doctors, dentists, vets. Vets are a great resource. Yes, Smokey, I'm actually going to do a class here in Huntington next month. Chase can tell you where it is, and I'll make sure you get the details of it. But yeah, I do classes locally, and it's going to be a one-day trauma class, but I'm going to put on the success of that and the interest here locally. If people want to do it, I'll do a 2-day full-blown class also, and then I've got a 2-day advanced class also, and that really goes into some really advanced things, some minor surgical techniques and stuff like that. If any of you took my wound care class at the last SRF, it was just a half-day class, we did some minor surgical procedures in that. Hey, Amy, I don't know, if you're familiar with some of the festivals coming up, the Kentucky Sustainable Living Festival, the Self-Reliance Festival, things like that. Those are great resources to go and meet people, and you'd be surprised you'll probably meet somebody who lives 20 minutes from you. Midwest Preparedness Festival, they're kind of the three sisters. They all kind of self-promote each other with these festivals, but all the people I'm talking about that I know in this chat right now, I've met through that network, except, for my son, but I've met him through that community, and it's a large community, but there's individual communities through that, and that's, you can start building community by being part of that large community and kind of whittle it down to find people close to you. Yeah, love that, Chase. Yeah, Amy, digital SRF tickets great, but I would highly, highly, highly suggest if you can make it to SRF or Kentucky Sustainable Living Conference, I would do it. It is so worth it. There's people in here who've been to it. They'll tell you it's great just for the networking, just for the people you'll meet alone. It's not just the classes and great, amazing speakers, but it's the people you meet and the contacts you make. Yeah, I've got medicals. If you look on my YouTube channel, Benjamin, I've got some, and I am going to make some more. I've actually been gathering some equipment. I'm going to change how I do my videos. I was getting some advice from some friends of mine who have very successful channels quickly. Overton Windex, Evan Dixon, obviously, John, well, John's video guys too, that he has, Brandel and Austin. But yeah, I'm going to do some tutorials and how to pack some stuff. And I've done some on some specific kits and things like that, give you an idea. And specific equipment, how to use it and what it is, different radiations of it. All right, so what else you all want to talk about? Anything? Kind of start wrapping this up. Any equipment you want to know about? Anything I've got on my website you want to know about, or something that you want or need? Yeah, Jeremy's talking about SRF Digital is good, but the in-person is great. Yeah, I mean, Jeremy's been to Kentucky Sustainable Living. That's where Jeremy and I met, was at SRF, and we're actually friends. We've got our own little group. We literally communicate every single day, 5 of us, multiple times a day. So, you know, you'll meet some lifelong friends there. I can honestly say SRF changed my life. That's what made, you know, basically John Willis said I wouldn't start a business, so I got pissed off and did. And most of my friends now are from that larger community and stuff. That's the people who I want to be friends with and that I care about and that I learn from and network with and share things with. A portable MRI machine, Jeremy, believe it or not, yes, I can. I can also get you a portable ultrasound. That'll be a lot cheaper, by the way. But, you know, this community is the whole thing. I mean, I learned from you all. Hopefully I've passed on some actionable information for you all to go on. But I learn every day from this community. You know, John's lives, I learn from. And several of you have YouTube channels. And several people that, you know, that are friends. You know, Spags was on here earlier. I learned from him, from his channel. Just sharing things, but I've met all these people in person too. I have their phone numbers, you know. I can call them right now. They're actual friends. We've met in person. We've ate dinner together. Yeah, I've actually have a pull-out med tray right here for the micro rigs. These are great, the pull-out med trays. You can put a whole IFAC in them. You know, and I've got everything that I carry and more. Wound packing gauze, chest seals, duct tape, pressure dressing, nasopharyngeal airway, you know, all the stuff to stop that major stuff. I've got a needle. I took the needle out. It's somewhere here. Oh, there it is. Yeah, chest decompression needle. I mean, it's just for that stuff that's going to kill you in 5 minutes or less. And it fits in. This takes up the space of 2 AR mags, so you can fit in. You still have half of that utility pocket on the micro chest rigs. I sell a fill kit for this. It's basically the same kit that you would get for the pocket organizer, the pocket kit. I sell fill kits for the tear-off IFAC that you can belt mount or you can chest mount or whatever. I've actually seen people, for some reason, they've actually taken it off, you know, taken the Velcro part off here and taken this and stuck that into the utility pocket of the chest rigs. I think it would be a little difficult to get out. It's kind of redundant because then you have to open up some more stuff, but to each their own. I mean, how you want to carry it is up to you. Just as long as you're carrying medical, that's great. And get the training. No, I've got nasal plugs, Amy. I'm looking in. I actually do carry a wound packing. I put it in my my basic and advanced wound care kit, and my large, what I call the Homestead Medical kit, which is a trauma kit. And Homestead, it actually comes in a big plastic tub. But I've got that packing. It's the same thing as that Rhino packing that you're talking about. But yeah, it's the ribbon packing basically. But that is something I can carry. I can get it if you want it. Let me know and I'll order it. I'll put it on the website and let you order it, and I'll make sure you get it. I can get it within a few days once I get it from one of my suppliers. Yeah, Smokey, just get on the website and order it, and I'll get it delivered to you. You don't have to worry about shipping or anything like that. I'll get it delivered to you. But yeah, I've got that stuff in stock. I can get it to you whenever. But yeah, I mean, if you want the Rhino packing, just send me an email, chuck@homesteadmedical.us, and I can get it and I'll stick it on there. It wouldn't be a bad thing to have. I'm actually coming up now with, and it should be on there probably. I was going to already have it on there, but I'm actually coming up with an emergency dental kit. What to do, obviously, dental, you get a toothache or an infected tooth, impacted tooth. I'm telling you right now, it's going to take you out of the fight. No matter how strong you think you are, it will. I'm out of decomp needles right now, Smokey. But I will have them in as soon as they get them in. I've actually got them backwards. So as soon as they get them, NAR gets them, because they've been sending them to the military and overseas and everything else, I will have some. This is a different brand than what I normally use. So I'm not crazy about it, but I may use it as a backup. And then I'm going to have some that'll be slightly more expensive. It's the same company that makes these decomp needles. They've just got a little bit more advanced one. It's a little better, and it's going to cost a few dollars more, so I'm probably going to stock those. Those are supposed to be in next week, and I'm going to be getting some of those in 14 gauge. Yeah, dental is huge, so I'm coming up with it. It's not just some little kit. I mean, it's going to be a standalone dental emergency kit that'll have tools. It'll have temporary cavity filling. It's going to have something more permanent for cavity. It's going to have some clove oil, and I'm looking at a few other things, some topical painkillers and stuff like that, and other things for, and packing for other dental type of injuries, mouth injuries. So it's not just going to be strictly for like teeth, but I'm also going to include in it a recipe for homemade toothpaste. It's actually a healing toothpaste that actually helps heal already cavities that are already produced, and it kills the bacteria, the specific types of bacteria that get in teeth and in the enamel, and it also naturally strengthens your enamel. It's an all natural toothpaste you can make at home. So I'm actually going to put that recipe in there with that kit, so you can make your own and have that on hand. I did a lot of research on this particular toothpaste, and it's really cool. So I'm going to stick that in there too, but I should have the kit finalized. I'm just waiting on one other thing to come in to see if I like it. I've just been playing around with some different products for it, and I'll have it put together and have them on the website next week. We'll get you the training, Smokey. You're close now, so you're in our neck of the woods. You've become an official West Virginian, so we'll get you trained up. If not, I could do a class just for you all, and I could make my sister-in-law, or not sister-in-law, my daughter-in-law, she needs to take it too. And it wouldn't hurt Chase to have some more training. But I'm sure I can get other people too. I've got people locally who are interested, so. All right, anything else? Any other questions you all have? Anything else? Like I said, I'm coming out with a dental kit. I'm also looking at an ear, nose, and throat kit to deal with emergencies of those type, especially the eyes. So I'm putting together some stuff for that. I'm going to have that. I'm going to have some more specified kits for that. I'm actually putting together a separate pediatric trauma kit too. So I'm gonna have a bunch of new products coming out and adding some stuff. And I'll have the snake staff tourniquets should be on there end of next week. The new dental kit. And then a few other products I've added. If you actually want a true litter, a stretcher, I've got that on the website now. I'm going to have some soft stretchers, some portable fold-up stretchers that are small, that are like, I think they're going to be like 30 bucks, that you can carry in a backpack. It's real small. It literally folds up to about the size of this, but maybe a third of the thickness. You can stick it into a backpack. Also, I want to show this. This is combat arms training. Andrew makes this, and this is a medical, it's a backpack insert, and it's got organization on the inside. It's got little loops. You've got loops on the side specifically for smaller things like nasal airways, scissors, decomp needles, but it's even got loops on top of the larger loops underneath here, right here. Lots of organization in it on top, and then on each side, it's got two pockets. It's got this pocket that's got a cover, and then it's got a slip pocket here on each side. So these are great for gloves or other small items you want secure. Chest seals. I've got two space blankets, emergency blankets in here, some duct tape, and it just zips up, and it's got a nice handle, so you could do an insert like in a backpack or a bag and have a pretty extensive medical kit in here. It's not in here now. I've been playing around. Well, I've got a splint in here. Trauma stuff, you can see shears. It's got loops here on each end, loops on the side. So I've got a lot of stuff in this that it's more than just an IFAK. It could be a true trauma kit. So I've been playing around with that. I'm going to start offering fill kits for that also, and have the links where you can order that directly from Andrew. Well, it's a little too big for the side pouch. I actually tried that, Jeremy. It's just, you can't get it zipped. It's a little too big. It's a little longer than the pouches themselves, but it fits in the day pack very easily. Like, not the very outside zipper part, but that second zipper, the one that's the compartment that's in between the large and the small on it, it'll fit in that very easily and nicely. And then I like to use things too, is I've got different stuff. The flat packs that John makes, I think, are great for smaller individual kits, purposeful kits. The dental kit will fit in the one of the large flat pack, because it comes with a full dental tool set, not just the little pick and a mirror. I mean, it's got 8 tools in it. Different stuff for dental emergencies. It'll come with that kit and some other things, but it'll fit in. This is the medium, but the largest size flat pack, it fits great in there, and it's small. These are great for anything you can use for organization, but a lot of different purposeful type med kits, wound care kit stuff. The large flat pack that he has, you can actually fit a skin stapler in it that holds 35 of the large staplers that I sell. Skin stapler on the website on that, and you can put a true wound care kit in that. So it's a dedicated pouch, and I've actually got some in mine, my work kit. I keep those pouches in there that I can pull out that are purposeful pouches in there, down in here on this. I've got this thing bursting at the seams. That's why I asked John to make a bigger one, which he's been making for months. And if you see this, John, make that damn backpack. Yeah, flat packs are one of my favorite too, Smoke. I don't even know how many I have, to be perfectly honest with you. I've got them everywhere in everything. Not right now, Jeremy, with the flat pouch. Probably I'll see if it seems to be a popular item, I will probably add that. Like, I didn't start selling these immediately. I just fill kit for it, but now I've talked to John. I've actually got them. I've got these in 4 different colors. They'll come with this. The pricing, I don't upcharge anymore. I think it's $55 for these. That's what I charge you when I figure in the pricing for the equipment that goes in it. I'm not upcharging you for these kits. I'm only charging you what I actually pay for them. And yes, I pay retail for them, just like you would. Yeah, I'm sure you'll take some off my hands, Chase, like you have lots of the SOE equipment that you have. Another thing, quick thing I just saw, if your vehicle med pack, get a good pair of leather gloves. I keep these clipped on it, even though I've got probably 2 other pairs of leather gloves in my vehicle. Keep these in there because if you come up on a car wreck or something, you're going to help out somebody or whatever. There's glass, there's sharp metal. Protect your hands. And another thing, I highly, highly, highly recommend every med kit, I have a headlamp. Some sort of a headlamp. I have, this one is just a cheap Energizer one that I keep in because in my big main in here, I keep, well, it's actually the side pouch, I keep a headlamp. And my EDC stuff, I keep a headlamp. You want to be able to work with your hands, not holding, having to take a flashlight out and hold it down on something with one hand tied up. You don't want to do that. And I keep, I keep 2 flashlights on my body at all times, 2 different Surefires. But I have a headlamp literally in every EDC bag, every med kit, all these different med bags, every single one I have a headlamp in it, including my clinic bags, my procedure bags, because that way I've already got it. And the other trick I would tell you to do is every pouch you have individually, your organization, keep a pair of gloves. There's 7 pouches in this bag alone. I have gloves in each one of these pouches. Everything you go in multiple pairs of gloves because that way you may have gloves on you. You may already have some on, but if somebody comes up and helps you and you take a pouch off and throw it to them, they're probably not going to have gloves. That way you've got in there. Or if your gloves rip, they get soiled, too much blood, you need to change them, do whatever. You've got the gloves right there handy. I know it's missing. You still got my holster too, Chase. Along with all kinds of other things you've borrowed permanently. All right, well, if there's no other questions, I'm going to cut this. We've been going over an hour and a half, 97 minutes. So thank you all for coming in. Great conversations. I appreciate it. If you got any questions, you can get a hold of me, Chuck at homesteadmedical.us. A lot of you have my phone number. Smokey, if you don't already have my number, get it from Chase. Feel free to call me or text me if you need anything. I think you got it though. If you all need anything, as always, get a hold of me. You've got questions about medical gear. It doesn't have to be that you order from me. I'll answer them. I'll help you out. You're part of the community, and that's what we do. We help each other out. So feel free to contact me, email me. I've always got my phone with me. It comes directly. I get alerted when I get an email on that email account. Come join the conversations in the other groups. SOE does a live. John does a live on YouTube on his channel every night. It'll be starting here in about 20 minutes. I'm one of the moderators on it, so I'm on there just about every night. Chase is on there. A lot of the people who were in here tonight are on there. Support all the local channels. Spags Unfiltered, who was in here. Combat Arms Training, Andrew. Kentucky Sustainable Living, Jason was in here. Kentucky Sustainable Living Festival, support it. Jeremy has just started. Jeremy, is your business up and going? Are they able to order yet? Jeremy's doing some freeze-dried foods and stuff, which I'm sure will be excellent knowing him. So order from him when he gets his up. Oh, thank you, Amy. I appreciate you ordering. I did get an email. I didn't see it was an order, but it had that ding. So thank you very much. That was you that came in. I'll get your order processed quickly as I can and get it out to you. But yeah, support each other. I use special operations equipment. John gives me absolutely nothing to promote his stuff. I just believe it's some of the best equipment. All my medical bags, I switched over voluntarily. And believe me, I've owned all of them, all the big ones. I've switched them to him because John's stuff is literally bulletproof and it lasts. You can see I use mine. There's mud, dirt, stuff like that, and it lasts. you know, I've got several thousands upon thousands of dollars of products from him, and not just medical, all of his lifestyle stuff, his tactical stuff, you know, all those things. Use it, support John, go to his channel, support him. Specialoperationsequipment.com. You know, go to Jason's stuff, go to Grumpy was on here, the Grumpy Acres. Go to their channel. All the people that are in the community and stuff, support them and help support each other, promote each other's businesses. Radios, if you don't have communications, it goes hand in hand with medical. Make sure you go to radiomadeeasy.com and buy some radio stuff from Evan. Take his classes that are top-notch training. Invest in that, invest in your communications, because at some point you're going to need to call for help. You need to have those radio communications. And he just won't sell you radio. It'll come to your door programmed for your area, and it'll have other accessories that are better than the radio you're getting. So he'll absolutely take care of you. All right, folks. So if there's nothing else, I'm gonna get off here. John's live is gonna be starting here in a little bit. I'll be on there if you want to continue talking. Any questions? Just email me. I appreciate your all support. I appreciate you all for coming here, talk to me. I'm gonna start doing these regularly, doing probably a live at least once a week, and depending on how it goes, maybe more. I appreciate you all ordering. Amy, thank you very much for your orders. I greatly appreciate your support, and I will see you all next time. And if you need anything, don't ever hesitate to get a hold of me. Thanks.